The cool, antiseptic air of operating room 7 pricked Rina Volkov's skin. Every instrument shimmered under the theatrical lights, reflecting her nervous tremor as she meticulously arranged sterile drapes. This wasn't just any secret procedure. The hushed intensity vibrating through the elite Asclepius Medical Center spoke of a patient of unimaginable importance. Then, cloaked in a surgical gown, a figure entered, accompanied by the formidable Dr. Tanaka and Dr. Rodriguez, their faces grim. Rina, a rookie in this hallowed space, felt like an invisible cog, particularly when Dr. Tanaka, without looking at her, curtly reminded her to maintain silence and order. Her cheeks flushed, her small frame shrinking further. Yet, as the VIP, President Zahara al-Said, though no one uttered the name, was prepped, a flicker ignited within Rina. A hidden current of observation, honed in the harshest field hospitals, registered subtle anomalies in the baseline vitals, anomalies everyone else dismissed as pre-op jitters. They saw a humble nurse. She saw the silent signals of a storm brewing. They would soon face a crisis no protocol could address, and only Rina's quiet intuition, her forgotten expertise, would pull them back from the brink of global catastrophe. The air in operating theater 1 at Asclepius wasn't merely sterile, it was electric, thick with the silent hum of meticulously calibrated machines and the unspoken weight of expectation. Chrome gleamed under the unforgiving xenon lamps, reflecting the cool blue of scrub suits worn by the medical elite. Every instrument was perfectly aligned, every monitor displayed a crisp, unwavering feed of data, a testament to the hospital's unwavering pursuit of perfection. This was not just an operating room, it was a fortress of medical prowess, where mistakes were anomalies, not possibilities. Rina Volkov, tucked away near the instrument trolley, felt the immense pressure like a physical weight. Her role as a rookie circulating nurse felt infinitely small amidst the giants around her. Dr. Kenji Tanaka, his neurosurgeon's hands already gloved, moved with a balletic precision that belied his arrogant demeanor. He was a maestro, and the OR was his orchestra, with everyone else, especially Rina, relegated to background accompaniment. Across from him, Dr. Octavio Rodriguez, the anesthesiologist, a man whose glasses seemed permanently fogged with the steam of protocol and procedure, meticulously calibrated the anesthesia machine. His gaze, even through the glass, was intense, dissecting every waveform on his bank of monitors. Nurse Volkov, Tanaka's voice, sharp and precise as a scalpel, cut through the quiet. He didn't look at her, instead focusing on the drape being positioned over the patient's head. Ensure the cranial access set is positioned optimally. We will not tolerate a single misplaced instrument today. Rina's cheeks burned. Yes, doctor. She moved swiftly, her movements practiced, albeit with an added tremor of nerves. The specialized tray, gleaming with a high-speed cranial drill, microsaws, and delicate retractors, was heavy in her hands. She placed it precisely where Tanaka's assistant could reach it, her small act of efficiency unnoticed amidst the larger preparations. President al-Said, now fully prepped and draped, her face obscured, was already under general anesthesia. Rodriguez had intubated her with a smooth, practiced hand, the rhythmic whoosh of the ventilator now filling the background. The patient's initial vital signs, displayed prominently on the large central monitor, were within normal limits: blood pressure 120/78 mmHg, heart rate 72 bpm, SpO2 99%, EtCO2 35 mm of mercury. Standard, textbook perfect. But Rina saw something else. As she performed her final checks of the sterile field, her eyes darted to the vital signs monitor. A subtle flicker in the SpO2 reading, a momentary dip to 98%, then back to 99%, caught her attention. It was so fleeting, so insignificant, that Rodriguez, meticulously infusing propofol and remifentanil, didn't even register it. Then, a barely perceptible variability in the heart rate trace. Instead of a steady, unwavering line, there was a minute, almost imperceptible undulation, a slight broadening of the QRS complex that deviated from the preceding beats. It wasn't a warning alarm. It wasn't even a yellow flag. To anyone else, it was just the normal physiological noise inherent in any living system. But Rina's brain, trained in the unforgiving chaos of field medicine where normal was a luxury and subtle often meant imminent disaster, processed these anomalies differently. She remembered Dr. Elias, the maverick surgeon she'd assisted in war-torn regions, who had taught her to listen to the body's whispers before it screamed. "Dr. Rodriguez?" Rina's voice was soft, almost a murmur against the ventilator's sigh. She hated interrupting, hated drawing attention to herself. I've noticed a slight variability in the SpO2 and a minor heart rate oscillation. Nothing critical, but perhaps a closer look at the arterial line waveform? Rodriguez, his attention riveted on his drip rates, scoffed, a sound barely audible. "Nurse Volkov, we are operating on the president of the free world. There is no such thing as minor heart rate oscillation in this theater, only precise hemodynamics. The patient's vitals are textbook perfect. Focus on your instruments." He gestured dismissively towards the instrument trolley. "Any variability you perceive is likely an artifact of your inexperience." Rina flinched, her face flushing again. She retreated to her trolley, but her eyes kept drifting to the monitor. The artifact persisted. The SpO2 would momentarily dip, barely a single percentage point, then recover. The heart rate variability wasn't alarming, but it wasn't the steadfast rhythm expected of an otherwise healthy patient under carefully titrated general anesthesia. It spoke to her of a systemic microinstability, a vascular fragility that was being carefully masked by the anesthesia. Dr. Amina Jabari, head of surgery, stood near the observation window, her arms crossed, her expression unreadable. She had overheard Rina's comment and Rodriguez's terse dismissal. She offered no intervention, her sharp eyes scanning the room, assessing the team's dynamics and the president's status. She was a pragmatist, a scientist. Instincts were for hunches, data was for decisions. And the data, as presented by Rodriguez, was indeed perfect. Tanaka, oblivious to the quiet exchange, held up a final scan. "Here we are. The precise lesion location for the planned ablation. A superficial arterial venous fistula, quite small, easily managed. A minor procedure, as specified." His tone was confident, bordering on triumphant. "Dr. Rodriguez, maintain current anesthetic parameters. We commence in 5. Rina's stomach churned. A superficial AVM, usually congenital, might be small, but it could be indicative of a broader, more insidious vascular fragility. Her field experience had taught her that sometimes the visible problem was just the tip of a much larger, unseen iceberg. What if this minor procedure was about to trigger something far more catastrophic? The subtle vital sign patterns felt like harbingers, like the barely perceptible tremble of the earth before a quake. She tried again, her voice a little firmer this time, though still respectful. "Dr. Tanaka, Dr. Rodriguez, I just wanted to reconfirm, the preoperative angiogram showed no other areas of vascular anomaly, correct?" "Because the fluctuations." Tanaka finally turned, his gaze cold and impatient. "Nurse Volkov. Your role is to assist, not to question a complete preoperative workup performed by a team of world-renowned specialists. The angiogram was exhaustive. There are no fluctuations relevant to the case at hand. This is a simple, contained procedure. Now, hand me the microtweezer." The dismissal was absolute. Rina felt her face grow hot, her earlier attempts to warn now feeling like foolish insubordination. She silently handed him the requested instrument, her hands trembling slightly. The giants of Asclepius moved with an air of unshakable authority, utterly convinced of their command over the situation. They saw a minor procedure, a routine fix. Rina saw a fragile equilibrium, poised precariously on the edge of a precipice, and the subtle, ignored whispers of the president's body now felt like a scream only she could hear, trapped within the sterile confines of the silent ore. The first cut was about to be made, and Rina knew, with a certainty that chilled her to the bone, that the calm was an illusion. The storm was coming. The air in the ore, previously taut with controlled expectation, thickened with an almost imperceptible hum of rising pressure. Dr. Tanaka, his gaze fixed through the surgical microscope, adjusted the focus with meticulous precision. "Scalpel," he commanded, his voice a low, steady murmur. Rina, her earlier tremor now suppressed by professional discipline, handed him the instrument. The blade, catching the sterile light, gleamed as it traced a careful line. The initial incision, clean and precise, opened a window into the delicate architecture beneath. Blood welled, controlled instantly by Tanaka's expert cauterization. The rhythmic beeping of the monitors, a constant symphony of life, held steady. But Rina, her eyes flicking between the surgical field and the array of screens, saw it. A minuscule flutter in the arterial line waveform, a fleeting dip in the CO2 levels that shouldn't be there. It was gone almost as soon as it appeared, too subtle for anyone focused on the macroscopic view. She tightened her grip on the suction catheter. Tanaka worked with practiced grace, navigating the delicate neural pathways. "Microtweezer, please, nurse." "Dr. Tanaka," Rina began, her voice barely a whisper. The ICP waveform just showed a brief, erratic spike. "Rina, my focus is here," Tanaka cut her off, his tone sharper than before. "The monitors are stable. Maintain suction." Dr. Rodriguez, engrossed in his own complex dance with the anesthesia machine, glanced at the vitals. "Stable on my end, Nurse Volkov. Perhaps an artifact." He adjusted a dial, his expression placid. Dr. Jabari, observing from her position, gave Rina a fleeting, unreadable glance. Rina swallowed, a cold dread coiling in her gut. They saw stability. She saw a tremor before an earthquake. Tanaka continued, his focus absolute. He reached for a micro-drill, preparing to access the deeper structure for the minor repair. The whirring sound filled the air, a harsh counterpoint to the steady beeps. Then, it happened. It wasn't a slow progression, not a gentle worsening. It was a detonation. A sudden, violent surge of blood erupted in the surgical field. Not a trickle, not a seep, but a geyser, dark and arterial, blooming instantaneously from beneath the skull. The neat, controlled incision became a maelstrom of crimson. "What the?" Tanaka swore, recoiling slightly, his precise movements momentarily faltering as blood spattered the lens of his microscope. The ore instantly exploded into pandemonium. The monitors shrieked in unison, a cacophony of overlapping alarms. The once rhythmic pulse faded into a frantic, broken beat, then plummeted into a terrifying bradycardia. Blood pressure, seconds ago stable, crashed, displaying numbers that flashed red and critical. Oxygen saturation plummeted, the SpO2 waveform flatlining. Massive hemorrhage. Jabari's voice, sharp and commanding, sliced through the alarms, but her eyes, wide with shock, belied her outward composure. Source? Rodriguez, previously unflappable, was now a blur of motion. His calm veneer shattered. BP crashing. "Give me vasopressors." "Stat. Max dose." Her pupils are dilating, fixed and dilated. "She's herniating." He barked orders at his junior residents, his face pale with alarm, frantically pushing medications, adjusting ventilator settings. "ICP is off the charts. We're losing her." Rina, though her heart hammered against her ribs, felt her field training kick in, cold and sharp. Her years assisting the maverick doctor, patching up impossible wounds under impossible conditions, had forged a core of calm in chaos. She moved instinctively, pushing her suction catheter deeper, but it was like bailing water from a sinking ship with a thimble. The blood kept coming, obscuring the field, making identification of the source impossible. "Dr. Tanaka, control the bleed." Jabari yelled, pressing closer. "Identify the vessel." Tanaka, his hands slick with blood, tried to regain his composure. "I can't see anything. It's too diffuse. It's not a single vessel, it's everywhere." His voice was laced with disbelief and fear. This wasn't on the angiogram. There was no malformation. Rina, already aware of the futility of simple suction, pulled her focus back to the monitors. The vitals were a terrifying confirmation of her earlier dread, the rapid decline in Glasgow Coma Scale, GCS, the sudden, paradoxical bradycardia coupled with severe hypertension, Cushing's reflex, The irregular, gasping breaths, a classic, devastating pattern. She saw the subtle, chaotic fluctuations in the ICP that now, terrifyingly, were no longer subtle. Dr. Rodriguez. Rina shouted over the din, her voice surprisingly steady. The pressure swings are too wild. It's not just a blown vessel. It's the intrinsic vascular fragility. The malformation is widespread, diffuse. The pressure changes from the craniectomy itself will cause more tears. What are you talking about, Volkov? Rodriguez shot back, sweat beading on his forehead as he wrestled with a bolus of mannitol. This is a simple rupture of a small artery. No. Rina insisted, pushing forward, driven by an urgent certainty that transcended hierarchy. It's the underlying structural weakness. We need to stabilize the entire cerebral vasculature before evacuation, or it will just rebleed. We need to induce profound hypothermia, reduce metabolic demand, and administer a specific vasoactive agent to stabilize capillary integrity, not just blast her with general vasopressors. Tanaka, his instruments poised uselessly in the fountain of blood, looked up, his face grim. Hypothermia? Vasoactive agents for capillary integrity? Are you mad, nurse? We don't have time. We need to evaluate this hematoma now or she dies. She'll die if we go in blind. Rina countered, her gaze unwavering as she stared at the plummeting numbers on the screen. Every textbook craniectomy approach will tear more vessels because the problem isn't the single bleed, it's the system. This is an inherited microvascular crisis. I've seen it. Jabari, who had been barking orders for more blood and preparing the emergency craniotomy tray, paused. She looked at Rina, really looked at her, noticing the intensity in her eyes, the stark, unsettling certainty in her voice amidst the chaos. The junior nurse was describing a diagnosis so rare, so nuanced, it was almost unheard of in the OR. Yet, her words carried a weight that was terrifyingly credible. The president's vital signs were a terrifying testament to the severity of the crisis, spiraling downwards faster than any typical bleed. Give me the immediate craniectomy kit. Fast. Tanaka bellowed, slamming a bloody gloved hand on the sterile tray, his arrogance now replaced by sheer, desperate panic. We need to get this pressure off her brain. The OR was a blur of frantic activity, shouting, the metallic clang of instruments, and the relentless, piercing wail of alarms. The calm of Asclepius had shattered into 1,000 pieces. The president, once serene, was now a patient teetering on the precipice of death, her life draining away with every spurt of blood. And Rina, the rookie nurse, found herself alone in her desperate understanding, her unheard warnings now screaming into existence in the most catastrophic way imaginable. The storm was here, and it was raging. Amidst the pandemonium, Rina's eyes, honed by chaotic field clinics, fixated on the monitors. The vitals were peculiar, a flickering shadow in the data hinted at a rare inherited vascular malformation, a lesson from a maverick field doctor. Her heart pounded. She had to speak. Dr. Tanaka, Dr. Rodriguez, she ventured, voice barely audible, I think it's an inherited malformation. The bleed signature. Rodriguez snapped, Nurse Volkov, stay on your station. This is no time for junior speculation. Tanaka, oblivious, focused on the immediate crisis. Rina's stomach twisted. To be dismissed, her crucial insight ignored, was unbearable. This rookie holds the key, but will the elite team listen before it's too late? If you're captivated by Rina's uphill battle and want to see this underdog prevail, like and subscribe to witness Hidden Heroes rise. Her internal conflict raged, follow protocol or save a life. The OR was a maelstrom of failing desperation. Dr. Tanaka, his face slick with sweat, worked with a furious, almost frantic precision, attempting to open the cranial vault. The whirring of the craniotome was a harsh counterpoint to the relentless beep-beep-beep of the cardiac monitor, each sound a testament to the president's rapidly deteriorating state. Dr. Rodriguez, meanwhile, was a ghost of his usual composed self, barked commands echoing across the sterile field as he wrestled with the plummeting hemodynamics. Give me another unit of O-negative, stat. And increase the norepinephrine to 20 mics. Rodriguez commanded, his voice tight with strain. He was pouring fluids and vasopressors into the president, but her blood pressure refused to respond, her mean arterial pressure, MAP, stubbornly clinging to dangerous lows, threatening cerebral perfusion. The arterial line tracing on the monitor, once a robust wave, was now a shallow, erratic ripple, each beat a hollow promise. Rina, standing rigid by the monitors, felt an icy dread seep into her bones. Her gut screamed at the data flickering before her eyes. This wasn't just a massive bleed, it was behaving wrong. The initial rapid ICP spike was now replaced by a paradoxical plateau, despite the apparent volume of the hemorrhage. The blood pressure wasn't just low, it was flailing, reacting to Rodriguez's aggressive pressure management with sudden, violent dips and then barely sustained plateaus, never truly stabilizing. And the oxygen saturation, dropping below critical thresholds, was a death knell. She saw the familiar pattern, one she'd witnessed only twice before, under the most brutal conditions, with Dr. Ilara Vance, the maverick physician who'd taught Rina everything about field medicine. This wasn't a standard traumatic rupture or an aneurysm, this was something far more insidious. Her vitals are crashing, a scrub nurse cried out, fear lacing her voice. MAP at 45. ICP trending upwards again. We're losing her. Rodriguez shouted, his voice cracking with the admission of defeat. His hands hovered over the drug pumps, his brow furrowed in utter bewilderment. Nothing he was doing was working. He was following protocol, giving all the right medications, but the patient was slipping away. Dr. Jabari, head of surgery, stood near Rina, her expression grim. She was observing Rodriguez's desperate efforts, Tanaka's frustrated grunts as he worked the craniotome, and the overall chaos. But she also noticed Rina. The young nurse, though outwardly tense, had an unnerving stillness about her. Her gaze was locked on the monitors, her eyes tracing patterns no one else seemed to perceive. Rina's body language was screaming insight, even if her mouth was silent. Jabari, a veteran, recognized the glint of understanding in Rina's eyes, a fierce, unwavering certainty that contradicted her rookie status. The monitor let out a long, drawn-out beep. Asystole. Cardiac arrest. A collective gasp swept through the OR. Tanaka froze, his craniotome still. Rodriguez slammed his fist on the anesthetic console. Start chest compressions. Epinephrine. Get the defibrillator ready. But Rina didn't move towards the crash cart. She didn't reach for the paddles. Her voice, though quiet, cut through the sudden, horrified silence like a scalpel. It's not enough, she stated, her voice surprisingly steady, though her heart hammered against her ribs. We're chasing the wrong enemy. Every head swiveled towards her. Tanaka, still holding his craniotome, glared. Nurse Volkov, this is not the time for amateur diagnoses. Amateur? Rina's eyes flashed, a steely resolve hardening her features. Dr. Rodriguez, your pressors are not stabilizing because the vessels themselves are fundamentally compromised. Dr. Tanaka, your craniectomy, while necessary, won't stop the underlying bleed effectively unless we address the true vascular fragility. This isn't a simple rupture from trauma or aneurysm. This is an acute, catastrophic hemorrhage from an undiagnosed, inherited microvascular malformation. The room went silent, save for the mechanical compressions now being performed on the president. Rina took a deep breath, the sheer audacity of her intervention electrifying the air. The patterns, Rina continued, pointing a gloved finger at the ICP waveform that was now stubbornly flatlining, then to the erratic arterial line, are classic. The initial hemorrhage wasn't just a sudden arterial burst, it was a cascade, a systemic failure of extremely fragile, tiny vessels collapsing under normal pressure variations. That explains the rapid expansion of the hematoma beyond what a typical aneurysm would cause, and why the blood pressure is so resistant to conventional pressors. The vascular walls themselves are weak, diffuse, like wet tissue paper. Your norepinephrine is constricting them, yes, but it's also increasing shear stress, causing adjacent vessels to rupture, exacerbating the bleed rather than controlling it. Rodriguez scoffed. A junior nurse diagnosing a rare inherited malformation? Volkov, with all due respect, that's absurd. We have no imaging to support that. Because it wouldn't show up on a standard CT or MRI. Rina retorted, her voice gaining strength, her humility momentarily forgotten in the face of imminent death. These are often microscopic, diffuse, not a single focal point. They're a structural defect. And the sudden cardiac arrest now isn't just from hypovolemic shock, it's also from a severe electrolyte imbalance caused by the rapid, massive capillary leak and the body's desperate, failed attempt to compensate. Dr. Jabari, who had been observing Rina with growing intensity, finally stepped forward. She looked at Tanaka, then at Rodriguez, both of whom were visibly stunned by Rina's precise, confident outburst. Their conventional methods had failed. The president was in asystole. They had nothing to lose. What is your proposed course of action, Nurse Volkov? Jabari asked, her voice low but firm, a glimmer of respect in her eyes. It wasn't a question of dismissal, but an invitation. Rina turned to Jabari, relief washing over her that someone was finally listening. Dr. Rodriguez, we need to switch pressors immediately. We need vasopressin, not norepinephrine. Vasopressin acts on V1 receptors in smooth muscle, causing vasoconstriction without the same degree of shear stress, and it also helps with fluid balance. And we need to give a specific factor 8 concentrate. Factor 8? Rodriguez interrupted, incredulous. For a cerebral hemorrhage? Yes, Rina affirmed, unwavering. These malformations often present with a cofactor deficiency that exacerbates the bleeding, mimicking a coagulopathy. I've seen it. And for fluid management, we need to move away from aggressive crystalloids. We need plasma and tranexamic acid to stabilize any clots that form, but with extreme caution regarding volume. And Dr. Tanaka, she turned to the neurosurgeon, who was still holding his craniotome, his face a mask of bewildered frustration. When you open the skull, you cannot cauterize aggressively. These vessels are too fragile. You will rupture more. You need to use a pulsed, low-energy cautery setting, almost like spot welding, and rely on carefully packed absorbable hemostatic agents. The goal isn't just to remove the hematoma, it's to gently tamponade the diffuse ooze. They were hung in a tense silence. Rina's words, her specific, unconventional demands, flew in the face of decades of established neurosurgical and anesthetic protocols for this type of emergency. It was a gamble of epic proportions, a rookie nurse dictating a radical shift in strategy for the president of a nation. But the alternative was certain death. Jabari looked at the flatlining cardiac monitor, then back at Rina's unwavering gaze. Dr. Rodriguez, follow Nurse Volkov's instructions regarding the vasopressin and factor 8. Dr. Tanaka, prepare for her suggested cautery approach. I want a constant update on all parameters she's highlighting. The decision was made. The hierarchy had been upended. A collective, nervous energy permeated the room, transforming the chaos into a new, hyper-focused tension. The high-stakes gamble was on. The president's life, and perhaps the future of the nation, now rested on Rina Volkov's unprecedented intuition and her command of a rare, devastating medical truth. The OR was a tableau of controlled pandemonium, now unified by Jabari's stark directive. Dr. Tanaka, his face a mask of tight-lipped professionalism, moved to the cranial surgical field. The air crackled with a new kind of tension, not chaotic, but hyper-focused, a single, improbable command filtering through the layers of established medical doctrine. Scalpel, Tanaka's voice was clipped, almost robotic, as he took the instrument from the scrub nurse. The initial incision for the temporoparietal craniectomy was textbook, a swift, confident line through the scalp, exposing the underlying galea and temporalis muscle. But as he prepared for the next phase, Rina's voice, startlingly calm yet imbued with an undeniable authority, cut through the whirring of the suction and the faint beeps of the monitors. Dr. Tanaka, she began, her eyes darting between the surgical field on the large overhead monitor and President Al-Said's vital signs, projected on a separate screen near Rodriguez. The superficial temporal artery. It's significantly dilated, consistent with an aberrant feeding vessel. Rather than ligating immediately, I advise careful dissection and isolation. We may need to use it as a landmark to trace deeper. Tanaka paused, his hand hovering. The standard protocol was immediate ligation to minimize blood loss. To dissect it, it defied the principle of speed in a hemorrhage. He shot a glance at Jabari, who simply nodded, her gaze fixed on Rina. With a barely perceptible sigh, Tanaka adjusted his grip, switching to finer instruments. His movements became more deliberate, following Rina's instruction to painstakingly separate the vessel, revealing a pulsating, unusually tortuous pathway. Meanwhile, Dr. Rodriguez, still rigid with suppressed frustration, found himself reacting to Rina's next sequence of commands. Dr. Rodriguez, I'm seeing a subtle dip in systemic vascular resistance correlating with the initial scalp dissection. The cerebral perfusion pressure is acceptable for now, but anticipate a rapid drop once the dura is exposed. Prepare to titrate vasopressin up by increments of 0.02 units per minute, ahead of the anticipated drop, not in reaction to it. And keep a 50 cubic centimeters bolus of 3% saline ready. ICP management will be critical. Rodriguez grunted, his fingers flying over the anesthesia machine's controls, his eyes locked on the digital readouts. He'd never been told to anticipate a drop with such specific parameters, let alone preempt it. He was a master of reaction, not precognition. Yet, as Tanaka proceeded, the subtle dip Rina had predicted began to manifest, and Rodriguez, grudgingly, followed her instructions. To his shock, the CPP remained remarkably stable, avoiding the precipitous fall he usually battled. A flicker of something akin to bewilderment crossed his face. Tanaka continued, using the high-speed burr to create the initial burr holes, then the craniotome to fashion the bone flap. It was meticulous, precise work. As the last cut was made and the bone flap carefully elevated, exposing the dura mater, Rina's voice came again, sharper this time. Hold suction, Dr. Tanaka. The dura is engorged, indicating significant underlying pressure. Its texture is unusual. Not typical post-hemorrhagic edema. I suspect fragile vascular adhesions. A standard linear dural incision risks tearing an unseen feeder. Dr. Jabari, if you concur, I recommend a cruciate dural incision, meticulously performed with microscissors, exposing the full extent of the bleeder rather than a constrained opening. Start away from the presumed epicenter. This was even more unorthodox. A cruciate incision, while offering wider exposure, was often avoided in acute hemorrhage due to potential for wider bleeding from the dural sinuses. But Rina's reasoning, fragile adhesions, unseen feeders, hinted at a deeper understanding of this specific pathology. Jabari, leaning closer to the monitors, saw the subtle, almost iridescent sheen Rina spoke of on the dura. It was unusual. Proceed, Dr. Tanaka, she authorized, her voice low. Tanaka took the microscissors, his movements now a mixture of his own practiced skill and Rina's precise verbal guidance. Each snip was agonizingly slow, revealing a dark, angry hematoma pressing against the brain tissue. The brain itself, normally a pearly gray, was swollen and bruised. Now, Dr. Tanaka, the evacuation, Rina's voice was a steadying force amidst the growing pressure. Forget gross suction. Use the fine-tipped bipolar cautery, lowest effective setting. We are not just evaluating clotted blood, we are navigating a minefield of aberrant, gossamer-thin vessels. Identify the darkest, most superficial clots first. Work away from the presumed origin, creating a pathway. Rodriguez, begin slow, incremental infusions of factor VIII now. Maintain MAP at 65, no higher, no lower. Rodriguez, now sweating, followed Rina's directions with an almost desperate obedience. His instruments showed the factor VIII being infused, the vasopressin finely tuned. The ICP, constantly monitored, began to show the faintest signs of improvement, oscillating within a tolerable range instead of spiraling upwards. Tanaka, meanwhile, was experiencing a surgical revelation. Under Rina's guidance, he began meticulously dissecting the clot, not simply sucking it away. Rina's instructions were startlingly specific. Inferior aspect, Dr. Tanaka, about 2 centimeters medial to your current position. There's a smaller, pulsing vessel embedded in the clot. Do not suction near it. Cauterize it, gently, with a pulsed application, then continue evaluating around it. He followed her, his hands, trained for decades in precision, adapting to a new kind of surgical intuition. He located the pulsing microvessel exactly where she described. It was tiny, almost invisible, but undeniably there, a potential source of rebleed. He applied the bipolar cautery with a delicate touch, the vessel blanching, sealing. The precision was breathtaking. Good. Now, superior lateral, Dr. Tanaka. You'll find another cluster of fragile capillaries feeding into the main body of the hematoma. They're distinct from the normal vasculature. Gently irrigate with warm saline, then meticulously tease them away from the normal brain parenchyma before cauterizing. Minimize traction. Tanaka, operating deep within the cranial cavity, felt as if Rina were seeing through his own eyes, guiding his hands with an almost prescient clarity. He began to discern the subtle differences in the vessels, the faint, aberrant patterns Rina had described, patterns he, in his vast experience, had never specifically looked for. The fragile, almost spiderweb-like vascular malformation, which had been the president's ticking time bomb, was slowly being exposed, not torn. Minutes bled into what felt like an eternity. The hematoma, once a dark, impenetrable mass, slowly yielded. Bit by bit, with excruciating care, Tanaka followed Rina's commands, identifying and cauterizing the abnormal feeders, irrigating away residual clots. Each small success was met with a collective, silent release of breath in the ore. Rodriguez, watching the monitor, saw the ICP steadily decrease, the map stabilize within Rina's tight parameters, and the SpO2 hold firm. He was managing the most unstable patient of his career, yet, under Rina's direction, it felt controlled. He found himself anticipating her next instruction, an unlikely, almost symbiotic rhythm forming between the rookie nurse and the seasoned anesthesiologist. Dr. Jabari watched, mesmerized. Rina wasn't just giving instructions, she was conducting an orchestra of life-saving precision. Her field experience, her secret expertise, wasn't just intuition, it was a profound, almost innate understanding of the body's hidden vascular landscape. Tanaka, initially skeptical, was now moving with a focused intensity, his own expertise amplified by Rina's vision. He was no longer just operating, he was meticulously dissecting a complex, dangerous puzzle, piece by guided piece. The president's life, hanging by a thread, was slowly, miraculously, being pulled back from the brink. Tanaka's movements, once driven by a singular, almost aggressive determination, were now imbued with a meticulous, guided precision. The high-speed drill had given way to delicate microinstruments. Under Rina's watchful eye, he was meticulously dissecting the dura, exposing the swollen, pulsating brain beneath. The surface was bruised, discolored, a testament to the devastating hemorrhage that had erupted minutes ago. Wisps of fog from the Bovie cautery occasionally obscured the field, only to be cleared by the suction, revealing the relentless, crimson tide that needed to be evaluated. Pressure on the suction, Dr. Tanaka. Rina's voice was calm, almost conversational, yet carried an undeniable authority. Keep the tip away from the brain parenchyma. We need to preserve every viable neuron. Tanaka nodded, not taking his eyes from the microscope. The delicate suction cannula, barely larger than a pencil lead, danced at the edge of the hematoma, drawing off the thick, clotted blood that pressed dangerously against the president's brainstem. Rodriguez, his brow furrowed in concentration, adjusted the propofol infusion, chasing Rina's ever-tightening map targets. The central venous pressure, CVP, remained low, as per Rina's insistence, to reduce cerebral venous congestion, while the arterial line traced a stable, yet finely balanced, pressure waveform. Slowly, agonizingly, the pressure began to recede. The ICP monitor, which had been a terrifying spike, now showed a gradual descent, moving from the critical 40s into the high 20s. A collective, unspoken breath was held in the ore. This was the moment of truth, the evacuation was progressing. As Tanaka carefully cleared a particularly stubborn clot, revealing a section of cortex still glistening with residual blood, Rina's gaze narrowed. Her eyes, honed by countless hours deciphering the subtle nuances of damaged tissue and unforgiving field conditions, locked onto something no one else could see. Nestled within a convoluted gyrus, partially obscured by a thin film of blood and still swollen tissue, was a minute, almost invisible capillary. It wasn't actively bleeding, but it was distended, abnormally fragile, a spiderweb-thin filament that looked ready to rupture at the slightest provocation. It was a telltale sign of the rare, inherited vascular malformation she had hypothesized, a remnant, perhaps, of an old, underdeveloped microaneurysm that had somehow escaped detection until now. Dr. Tanaka, Rina's voice cut through the hum of the machines, sharper now, laced with urgent certainty. Stop suction. Look at 3 o'clock, just superior to the middle cerebral artery branches, deep in that sulcus. Tanaka paused, his hand hovering over the delicate field. I see residual oozing, Nurse Volkov, but it's minimal. We can manage that with packing once the main clot is out. He wanted to finish the evacuation, relieve the pressure completely. No, Rina insisted, her tone leaving no room for argument. Her finger, encased in a sterile glove, pointed to the monitor displaying the most minute vital fluctuations, then darted to the magnified surgical field on the large screen. That's not just oozing. That's a highly friable microvessel, part of the underlying malformation. It's under immense shear stress from the localized edema, and it will rebleed catastrophically if not secured now. A venous bleed will be harder to control later, and the pressure gradient will be exacerbated once we close. Dr. Rodriguez, brief increase in MAP to 95 for 5 seconds, then back to 80. Dr. Tanaka, use the microbipolar cautery, very low setting, just a feather touch coagulation. Do not clip. Dr. Rodriguez, without hesitation, pushed a bolus of phenylephrine, watching the arterial line trace briefly spike. Tanaka, his skepticism momentarily forgotten, stared at the spot Rina indicated. Under the enhanced magnification, he could now just make out the delicate, almost translucent vessel. He hadn't seen it, not truly, until Rina had forced him to look. The fragility was astonishing. His hands, usually so confident, now moved with a new, almost hesitant reverence. He took the microbipolar forceps, their tips barely larger than a pinhead, and approached the vessel. A faint whisper of smoke, a tiny sizzle, and the distended capillary shriveled, safely cauterized. Good, Rina breathed, watching the surgical field and the vitals intently. Now, resume evacuation. Steady. With the potential rebleed averted, Tanaka returned to the main task with renewed focus. The remaining hematoma, though stubborn, began to yield. He used a combination of gentle suction and careful irrigation, slowly washing away the last vestiges of the destructive clot. The crimson gave way to a healthier pinkish gray as the brain's surface, though still bruised, began to resume a more normal appearance. The sulci, once effaced by swelling, started to reappear. Final evacuation complete, Tanaka announced, his voice raspy with tension, surgical field is dry. No active bleeding. He peered through the microscope, confirming the complete removal of the offending blood and the successful cauterization of the identified malformation. Dr. Jabari stepped forward, her eyes scanning the monitor. The ICP had dropped steadily, now holding stable at a remarkable 12 millimeters of mercury. The MAP was a steady 82, the CPP, cerebral perfusion pressure, a healthy 70. The SpO2 remained at a perfect 100%. The heart rate, which had been erratic, was now a steady 65 bpm. A profound, almost palpable silence descended upon the OR. It wasn't just the quiet of concentration anymore, it was the quiet of a battle one. The rhythmic beeping of the monitors, once a frantic alarm, now sounded like a reassuring lullaby. Rodriguez let out a slow, controlled breath, his shoulders slumping slightly. President's vitals are holding stable, he confirmed, his voice laced with relief. Hemodynamics are excellent. Dr. Jabari's gaze, initially directed at the president's now stable vitals, shifted slowly to Rina. The rookie or nurse, her face still smudged with dried sweat, her eyes betraying an exhaustion that belied her calm demeanor, simply met Jabari's stare. There was no triumph in Rina's eyes, only the quiet satisfaction of a job expertly done. She was already mentally reviewing the postoperative care, considering potential complications, her mind moving relentlessly forward. Tanaka, for his part, slowly straightened, peeling off his gloves. He looked at the cleared surgical field, then at Rina. His expression was a complex mix of professional awe and dawning humility. He had seen the vessel only because she had told him precisely where to look, how to look. He, the celebrated neurosurgeon, had been blind to a critical detail that could have spelled disaster. "Nurse Volkov," he began, his voice surprisingly soft. That was an incredible call. I would have missed that microaneurysm. It would have rebled. Rina simply nodded, acknowledging the statement without seeking praise. It fit the pattern, Dr. Tanaka. The specific fluctuations in mean arterial pressure and the subtle change in venous return I was tracking indicated a specific type of underlying fragility. It's consistent with the vascular malformation I suspected. Dr. Jabari finally broke the silence, her voice firm but laced with an undisguised respect that few had ever heard from the formidable head of surgery. Indeed it is. Dr. Tanaka, begin closure. Dr. Rodriguez, prepare for reversal once we're secure. Nurse Volkov, your postoperative orders for cerebral edema management and neuromonitoring protocols will be followed to the letter. The tension began to dissipate, replaced by a quiet professionalism. The immediate crisis had passed. The president, though still critically ill, had been pulled back from the precipice. And it was all thanks to a rookie nurse, her secret expertise no longer a secret, but a profoundly life-saving truth. The impossible had been achieved. The hum of the ventilators and the rhythmic beep of the cardiac monitor were the only sounds now permitted to pierce the profound silence of the OR. Dr. Tanaka meticulously closed the cranial incision, his movements precise, almost ritualistic, yet imbued with a newfound quiet reverence. Dr. Rodriguez, his face still pale with residual adrenaline, began the careful process of reversing the potent anesthetic agents. Dr. Jabari, a figure usually radiating controlled authority, now merely observed, her gaze occasionally drifting to Rina, a silent testament to the seismic shift that had just occurred within these sterile walls. Rina, meanwhile, was already several steps ahead. She was adjusting the infusion rates for mannitol and hypertonic saline, meticulously charting the president's central venous pressure and preparing the specialized neuromonitoring array for immediate postoperative attachment. She moved with a quiet efficiency that belied the monumental event she had just navigated. Her hands, though bearing the faint tremor of exhaustion, were steady, focused on the next critical phase of patient care. "Get the portable CT scanner ready," Dr. Rodriguez, Jabari instructed, her voice regaining its usual command, though softer now. "We need a stat post-op scan to confirm evacuation and assess for any residual malformation components. Nurse Volkov, I want you right there, interpreting." Minutes later, the president, still deeply sedated, was carefully transferred to the portable CT gantry. The air in the makeshift recovery area crackled with a different kind of tension now, one of anticipation rather than panic. Tanaka, Rodriguez, and Jabari huddled around the console as the images began to populate the screen, slice by excruciating slice. Rina stood slightly apart, observing the monitor with an intense, almost preternatural calm. As the sagittal and axial views scrolled, a collective gasp escaped the doctors. The massive epidural and subdural hematomas were gone, meticulously evaluated. The midline shift, which had threatened immediate herniation, was resolved. But it was what lay beneath, now starkly visible, that truly solidified Rina's extraordinary claim. "There," Rina murmured, stepping forward and pointing a gloved finger at a specific area on the screen, a network of tortuous, abnormally dilated capillaries nestled deep within the frontal lobe, close to the original bleed site. A type 2 cavernous malformation, likely a variant of capillary telangiectasia. Notice the mulberry appearance, the varying signal intensities indicating different stages of hemorrhage, old blood, new blood, gliotic rim. It's subtle, but unmistakably present, confirming it was the true source of the hemorrhage. Dr. Tanaka leaned in, his usual dismissive scowl replaced by an expression of pure astonishment. By the gods, it's there. A low-flow lesion. That explains the lack of rapid arterial bleeding during the initial rupture. And the friability, it would have been missed on routine pre-op imaging unless specifically looked for with high-resolution angiography. The popcorn or mulberry appearance is classic. He traced the outline of the lesion with a trembling finger. It's exactly as you described, Nurse Volkov. A web of dysplastic vessels, barely discernible before hemorrhage, but clearly the nidus of the crisis. Dr. Rodriguez, who had prided himself on his encyclopedic knowledge of neurological pathologies, stared at the image with a mixture of disbelief and awe. The subtle changes in central venous pressure, the rebound hypertension after initial hypotension. I thought it was just the body's compensatory mechanisms, but you saw this. You saw the cause behind the symptoms, not just the symptoms themselves. How did you know to look for this specific entity? Rina's gaze softened, her eyes distant for a moment, recalling the dusty, makeshift clinics. My mentor in field medicine, Dr. Alastair Finch. He was eccentric, often unorthodox, but he taught me to see patterns, not just isolated symptoms. He called it reading the whispers of the body. We often dealt with trauma, but also with unusual congenital malformations presenting acutely in remote areas. He'd seen a handful of these cryptic type 2 CMs erupt in similar, unpredictable ways. The particular hemodynamic signature, the rapid, unexplainable fluctuations that weren't correlating with standard blood loss or ICP changes, it was a pattern he drilled into me. Dr. Jabari straightened, her formidable presence filling the small space. She turned to Rina, her eyes piercing but now devoid of any trace of skepticism, replaced by an unmistakable respect. This is beyond pattern recognition, Nurse Volkov. This is a profound level of diagnostic intuition coupled with an intimate understanding of neurovascular pathology. A level of insight rarely seen, even in senior specialists. She paused, then continued, her voice resonating with an uncharacteristic humility. We all underestimated you. Profoundly. Your observations were not merely data-backed as I initially acknowledged, they were prophetic, saving this patient's life and potentially averting global destabilization. The gravity of the situation returned. The president of a major global power had been on the brink, literally a hair's breadth from irreversible brain damage, from death. A global crisis, geopolitical instability, humanitarian disasters, all potentially averted by this quiet, unassuming nurse. The relief in the room was palpable, a heavy cloak lifted from their shoulders. This changes everything, Dr. Tanaka muttered, running a hand through his hair. We need to plan for staged resection of this malformation once she's stable enough. And Nurse Volkov, your insights will be indispensable for the multidisciplinary tumor board. I apologize for my earlier dismissiveness. It was unwarranted and unprofessional, a grave error on my part. Rodriguez nodded vigorously. As do I, Nurse Volkov, you saved her life. You saved us from a catastrophe. Rina merely offered a small, tired smile. The patient is stable, for now. That's all that matters. There's still a long road to recovery, and we need to ensure meticulous ICP management, strict blood pressure control, and continuous neurological assessment. Dr. Jabari, I've outlined a few specific parameters for her post-op care focusing on preventing rebleed from the fragile remaining vessels and minimizing cerebral edema. She handed over a meticulously detailed sheet of instructions, complete with parameters for GCS monitoring and anticonvulsant therapy. Dr. Jabari took the sheet, her gaze lingering on Rina. Indeed. And as for your future, Nurse Volkov, I believe Asclepius Medical Center has just found its newest, most invaluable asset. Your humility, even in the face of such extraordinary validation, speaks volumes. The silence that followed was not merely respectful, it was reverent. The rookie or nurse, Rina Volkov, had not just performed her duty, she had redefined it. And in doing so, she had silently, powerfully, asserted her place among the elite. President al-Said's recovery was not immediate, but it was nothing short of miraculous, a testament to Rina's precise intervention and the surgical team's skill. For the first 48 hours, she remained intubated and heavily sedated in the neurosurgical intensive care unit, her brain a volatile landscape under the watchful eyes of sophisticated monitors. Strict intracranial pressure, ICP, management was paramount, with external ventricular drainage carefully calibrated by Dr. Rodriguez's team, ensuring that no residual edema or swelling could compromise her delicate brain. Her vital signs, meticulously stabilized post-op, were weaned from vasopressors, and gradual reductions in osmotic diuresis were implemented. Every flicker of her GCS score, every pupil response, was obsessively tracked. The world held its breath, unaware of the true extent of the crisis that had been narrowly averted. When she was finally extubated, 72 hours after the hemorrhage, her first conscious breath was met with a collective, silent sigh of relief from the medical staff and the layers of security surrounding her private suite. Neurological assessments initially revealed a subtle left-sided weakness and expressive aphasia, common sequelae of such a massive stroke. However, daily physical therapy, speech therapy, and occupational therapy began almost immediately, a testament to the comprehensive care at Asclepius. Within 2 weeks, her recovery was progressing at an astonishing rate, defying typical prognosis. She was lucid, engaging, and while her speech still required effort, her comprehension was intact. The official story released to the world was that President al-Said had undergone a planned, minor medical procedure and was recovering well from a brief, unexpected complication. The true, near-fatal cerebral hemorrhage and its specific, rare cause remained a highly classified secret, known only to a select few at the highest levels of government and within Asclepius Medical Center. For the antagonists, the experience left an indelible mark, subtly reshaping their professional personas. Dr. Kenji Tanaka, the erstwhile arrogant neurosurgeon, bore the brunt of the internal critique. While his surgical dexterity during the craniectomy and evacuation was undeniable, the fact that a rookie nurse had pinpointed the rare vascular malformation he had missed was a severe blow to his ego. In the immediate aftermath, his usual swagger was replaced by a more subdued, almost introspective demeanor. He still commanded the oar, but the sharpness of his edge had been dulled by a newfound humility. During postoperative rounds, he would often pause, allowing Rina to articulate her observations on subtle shifts in the president's hemodynamics or neurological status, a silent acknowledgement of her diagnostic prowess. He even, on one occasion, sought her out to discuss a particularly challenging arteriovenous malformation case scheduled for the following week, a clear, if unspoken, admission of her unique insight into vascular anomalies. His reputation as a brilliant surgeon remained, but it was now tempered by the understanding that brilliance could come from unexpected sources. Dr. Octavio Rodriguez, the protocol-obsessed anesthesiologist, experienced a similar, albeit different, paradigm shift. The near-catastrophic hemodynamic instability had shaken his unwavering faith in standardized procedures. While his adherence to established protocols was exemplary, it was Rina's unconventional, data-backed demands that had ultimately stabilized the president. Post-op, he was observed spending more time in the medical library, not just reviewing anesthetic pharmacology, but delving into rare genetic vascular disorders and their impact on physiological responses. His reports became more detailed, his questioning of surgical nurses less dismissive. During subsequent complex surgeries, Rina noticed him occasionally glancing her way, a silent invitation for her observations, his rigid posture now capable of slight, almost imperceptible, flex. He would still bark orders, but there was a new nuance, a crack in the facade of his absolute certainty. Dr. Amina Jabari, the head of surgery, emerged from the crisis with her formidable reputation further solidified. Her initial skepticism had been swiftly overcome by her pragmatic leadership and, crucially, her willingness to listen when confronted with irrefutable data. She had made the difficult, high-stakes decision to trust Rina, and it had paid off spectacularly. Internally, she championed Rina, ensuring her pivotal role was formally recognized within the hospital's confidential records, even as it remained unpublicized externally. Dr. Jabari became Rina's quiet protector and mentor, understanding that such a unique talent needed nurturing, not just exploitation. For Rina Volkov, the aftermath was a whirlwind of internal debriefings, commendations, and a new, unspoken status within the elite walls of Asclepius. Her official commendation, delivered personally by Dr. Jabari and the hospital's CEO, was discreet but profound, detailing her extraordinary diagnostic acuity and critical intervention. She was offered a fast-track promotion to a specialized vascular surgical liaison nurse role, a position tailored to leverage her unique expertise. This would involve consulting on complex cases, assisting in preoperative planning, and maintaining a critical presence in high-risk vascular surgeries. Yet, amidst this unprecedented professional ascent, Rina remained Rina. Her humility was not an act, it was intrinsic. She still arrived early, still organized the instrument trays with meticulous care, and still greeted every intern and orderly with the same quiet respect. The whispers followed her through the corridors now, "That's her, the one who saved the president," but she moved through them unperturbed, her focus always on the patient, on the intricate dance of life and death that played out daily in the OR. She accepted the promotion, not out of ambition, but out of a deep sense of responsibility to apply her gifts where they could do the most good. Her authentic life, grounded in service and observation, continued, now merely amplified by a profound, if unspoken, authority. She hadn't sought fame or recognition, only to do her job to the best of her ability, guided by an intuition honed in the crucible of field medicine. In a world often quick to categorize and dismiss, Rina Volkov's quiet triumph resonated as a powerful testament. It underscored that true expertise isn't solely forged in prestigious institutions or emblazoned with titles, but can equally blossom from humble origins, nurtured by experience, observation, and an unwavering commitment to the subtle truths that often lie beneath the surface. Her story, though known to only a few, became a quiet legend within Asclepius, a reminder that the most profound insights can often come from the most unexpected voices, urging all to listen more closely, to observe more keenly, and to never underestimate the quiet power of a humble heart. She continued her work, now a silent sentinel in the OR, forever watching for the unseen, ready for the next challenge, a beacon of human intuition in the meticulously scientific world of medicine. Rina Volkov's journey at Asclepius wasn't about seeking glory, but the quiet validation of truth. Her story, though initially overshadowed, powerfully reminds us that true genius often whispers from unexpected corners, challenging established hierarchies and demanding that we look beyond titles. It's a testament to the fact that profound expertise isn't always loud or flashy, but can be a silent, persistent force, honed by unique experience and unwavering observation. What resonated most with you in Rina's incredible display of intuition and courage? Share your thoughts in the comments below. If this story of an unsung hero inspired you to appreciate the hidden depths in everyone, please hit that subscribe button. Let Rina's unwavering commitment be a reminder: listen closely, observe keenly, for the most impactful insights often come from the humblest hearts, ready to illuminate the way.